Hi everyone, I want to talk about complications of influenza infection, or commonly called flu. So if someone around you is down with flu, what are the possible complications he or she may be faced with? Okay, let's go. Pneumonia. Pneumonia is the major complication. Can be influenza pneumonia or secondary bacterial pneumonia, or both. Okay, so pneumonia could be caused by the influenza A or B virus itself, or there is secondary bacterial super infection causing bacterial pneumonia, or both. What is the primary influenza pneumonia? When that occurs, what are we going to be faced with? There will be severe lung infection directly, okay, and the symptoms increase persistently. No resolution of symptoms. There will be very high fever, dyspnea, cyanosis, but good news is pneumonia that is caused by the primary influenza virus is less common. But when it happens, it is the most severe. It can be found in anyone, but more in those with respiratory disorders or increased left atrial pressures. So it is severe lung infection directly caused by the virus itself. The symptoms of the flu will be persistent and increase. That is going to give clue. And then I want you to listen to the next one so that I'll be able to compare and contrast and know that it is true. The presentations will be different. Okay. The chest x-ray, here there will be reticulonodular opacities going to consolidation. When you take the CT of the chest, it's going to be patchy, gangulous opacities with centrilobular nodules. When it is bacteria superimposed pneumonia, if it is not caused by the virus itself, then there will be initial improvement of symptoms. Unlike when it is caused by the virus itself, when there will be no period of improvement, but the situation is getting worse. Symptomatically. In bacterial superimposed pneumonia, there will be a period of initial improvement. Then there will be exacerbation of symptoms. 1 to 2 days, there may be no fever at all. Then the individual will tell everybody, I'm fine, oh, I'm good now, to go back to work or to go back to school or wherever. Then suddenly there will be relapse with increased fever, cough with purulent sputum, and respiratory distress. Unlike when the pneumonia is caused by the virus itself, there will be no period of initial improvement, let alone experiencing relapse. But in bacterial superimposed secondary pneumonia, there will be period of wellness, period of initial improvement with no fever, then relapse. The agents when it comes to secondary bacterial infection could be strep demo, Staphylococcus aureus most of the time in many people, Streptococcus pyogenes, Pseudomonas aeruginosa, Haemophilus influenza, Klebsiella pneumonia, Morizella catarrhalis, and Escherichia coli. It can be methicillin resistant Staphylococcus aureus when it is Staphylococcus aureus, or lucky enough to be methicillin sensitive Staphylococcus aureus. Can have both viral influenza A or B combined with bacterial pneumonia. That would be horrible. Still on complications, There's possibility of acute myocardial infarction. The individual could come down with myocarditis, pericarditis, and central nervous system involvement. And in that case, there's possibility of encephalopathy, encephalitis, transverse myelitis, aseptic meningitis, and Guillain-Barré syndrome. So, for people coming down with signs of flu and they are right before you, imagine the number of stuffs that you need to rule out. Possibility of toxic shock syndrome is also there with staph aureus and influenza B infection. And with that, I come to the end of possible complications of flu infection. You could say that it's a very serious disease. That's why you need your flu shot and present on time when you have the symptoms. Help the grandpa and grandma and those little kids that may not be able to take decisions by themselves. Thank you for listening to my presentation. Kindly go over all my presentation as far as flu is concerned, and you should be fine every year. And I'll play that you subscribe to my channel and give me thumbs up if you like this presentation. Leave comments if you like. Ask questions if you like. And if you subscribe, you'll get the presentations immediately they are published. Thank you.